Assalamu alaikum everybody, and thank you so much for joining us today. So the whole idea of having this webinar, especially for our doctors and especially the junior doctors, was to ensure that everybody gets some idea about how samples should be collected for microbiology tests. So as you might all be aware of the fact that Shaukat Khanam is a cancer hospital, and we have an excellent facility here at Lahore, and we have a sister hospitals in Peshawar. One second. So apologies for that. So as you might be aware that we have our main hub located at Lahore, and we have our sister hospitals at Peshawar. We have our upcoming hospital in Karachi, but our main laboratory hub is based in Lahore. So apart from our main hospitals, Shaukat Khanam has a wide network of collection centers that are located across the country. And samples are submitted at these collection centers, and then they are transported over to Lahore. And at Lahore is where we handle most of our samples. So right now we have specialties under microbiology, under histopathology, hematology, cytology, chemical pathology, and all of these subspecialties and their samples are looked after here at the main hospital in Lahore. We also have stat labs that are strategically located in some cities, and other samples are dealt over there. So the whole idea was to give an introduction about how samples should be collected for microbiology cultures, and for what that are sent off to the microbiology centers to ensure so that you get good quality results, and whatever results that actually come out of these cultures give maximum benefit to the patient in terms of the organism, in terms of the antibiotics that are reported, and of course if you would like to discuss the report further, we'll be happy to provide you that facility as well. So moving on, I'll be starting my presentation now. I think we have enough participants online. So the title of my talk today was Significance of Microbiology Specimen Collection. I'm Dr. Sumaya Nizamuddin. I'm currently the section head of microbiology here at Shaukat Khanam Lahore. So starting off, I would like to explain exactly what a medical microbiologist is. So who are we? So a medical microbiologist is one with additional specialized training who contributes in the diagnosis of infectious diseases, guides treatment, and works with other physicians, pharmacists, hospitals, and public health professionals to ensure that the best quality laboratory results are available for patient care. And what exactly do we do? So we help in diagnosing infectious diseases. We provide consultation to clinicians regarding antimicrobial therapy, hospital infection control, about laboratory biorisks and biosafety management. We also help in education and research at undergrad and postgrad levels. And we also have some of us would play advanced roles in management and media and in public awareness. So these are just some of the things that a medical microbiologist would be involved in. Moving on. So why specimen collection is so important in microbiology? So that's because laboratory diagnosis of infectious diseases actually begins at the time of collection of clinical specimens. And this, the whole idea is when you're choosing a specimen to be sent to microbiology, you have to ensure that it's the right specimen that's been collected at the right time for the right test from the right patient, and that it is transported to the laboratory in the right environment. So these are some of the prerequisites if you're trying to get a laboratory diagnosis for an infectious disease. And proper collection of the appropriate clinical sample is the first step in obtaining an accurate laboratory diagnosis of an infectious disease. Moving on, microbiological tests are performed on isolates, and the whole idea is to identify the causative agent of the infection, and this obviously forms the backbone of the investigative process. Apart from that, if you are sending cultures to the lab and expecting antimicrobial susceptibility results, then the lab will be providing those to you as well. The only problem is that in the developing world, there's a lack of awareness and casual attitude among the junior staff, and that hampers collection of a good specimen, and then in turn hampers the definitive diagnosis of the infection that might be taking place in the patient. So we are trying to fill that gap with these sessions and these webinars, and hoping that doctors and physicians and their juniors would actually learn and get some awareness about how samples should be collected, how they should be stored, how they should be sent, so that we can get maximum benefit from the reports that are generated by the microbiology lab. So specific procedures in collecting specimens will certainly improve the quality of services of microbiology departments. So obviously, if you help us in getting good quality samples, the microbiology lab will be able to help you in generating good reports that would be helpful for your patient. So best specimen, why is it required? So one of the basic mantras of microbiology is garbage in and garbage out. So if we don't get a good quality sample in, we won't be able to produce a good quality report. So at the end of the day, you would need to help us for us to be able to help you. So good quality sample in turn will generate a good quality report. And diagnostic tests entirely depend on the quality of the specimens that are submitted. So poorly collected or transported specimens will lead to failure of isolation of the causative bug. And of course, if the sample is contaminated with environmental organisms or with the normal flora, that's another reason why we won't be able to isolate the bug that is the actual cause of infection. And the consequences: wrongful therapy, treatment failure, increased management costs. I'm sure everybody would understand what exactly happens when we are unable to diagnose or find out what is the culprit over here, and that leads to further investigative costs and further management costs. And most of the time, it's the patient who has to pay for these additional services, and that puts an additional financial burden on the patient and on the healthcare facility. So help the lab help patients. The basic thing that the lab at most requires is some clinical details along with the sample. And what clinical details do we need? Though I would be highlighting those here one by one. So the basic thing that we obviously need the demographics of the patient. We need the name, the age, the gender. We need the exact specimen nature. What is it? What is the specimen type? How was it collected? What was the date and time of collection? We would also need some idea about what exactly was happening with the patient, some major signs and symptoms. What was the professional diagnosis that was drawn up by the physician, whether it was a general diagnosis or the infective diagnosis. We would also like to know what antibiotics the patient was previously on or is currently on. This also is a very important piece of information that is often left out. Apart from that, it would be beneficial if the request slip also contains some information about, for example, does the patient have any prosthetic devices? For example, in the case of endocarditis, does the patient have any valves in place? In case of prosthetic joint infections, we need to know whether there are any prostheses in place. If the patient is immunocompromised in any way, if any previous cultures were recently conducted on this patient from our institute or from any other institute, any other relevant investigations that might come in handy, and of course the nature of the test that is requested. That is of utmost importance. And we would also request treating physician to either include an email address or a phone number that the lab could get in contact on later on if we had any further questions, or if we have to deliver any preliminary results that might be helpful to you in treating the patient. So these are some of the details that we would require. It's always beneficial to have these. There are many a time that we don't get this information, but obviously we go ahead and handle samples and cultures the samples nonetheless. But it would really be helpful if this information is provided to us as well. Moving on. So what are the phases of a microbiological test? So basically, The whole testing process is divided into three phases. There's a pre-analytical phase, there's an analytical phase, and there's a post-analytical phase. Pre-analytical phase is what happens at the end of the physician, where the patient is assessed, there's a provisional diagnosis that is made, a test is ordered, a specimen is collected, and that specimen is transported. So that involves the pre-analytical phase of testing. Analytical phase is what we actually do with the specimen. So we would evaluate the specimen, we would process it further, produce the results, validate the results, and then send off the report to the physician. And in the post-analytical phase is where the physician would receive the report, they would interpret the report, confirm their diagnosis with the results that they have received, and of course initiate treatment on the basis of whatever result has been produced by the laboratory. So all of these phases are essential to produce a good quality report. And so basically the cycle actually starts right at the point where the patient is being evaluated by the physician. Obviously they come up with some sort of diagnosis in their head, and perhaps they are suspecting some bugs in that infection, and that's how they actually decide on what tests are supposed to be sent off to the lab. Many a time physicians might not actually know about some specific tests, and it would always be handy to at least perhaps call the lab and discuss with them, for example, कि फला patient आया and this is what I'm suspecting, and what test do you think would be appropriate in this scenario. And that's where the lab could actually help you in deciding what would be the most appropriate test, or how much sample do we require for that particular test. And that's where the lab can actually help you, and of course the lab can actually also help you in interpreting the microbiology report whenever it is released by the lab. So scope of microbiology tests. So this slide is basically to tell you what microbiology tests would actually be able to tell you, or what information we would be able to provide you in reference to the samples that are submitted to the lab. So demonstration of pathogenic organisms in this patient specimen is the most definitive test in microbiology. But this would only be possible if there are adequate number of bugs or pathogens present in that particular specimen. And of course, this would only be possible if the patient actually has an infection. But we would also need to know that where some pathogens might not be isolated from a microbiological test, and failure to give you a positive result is not definitive. And it may indicate that perhaps the pathogen was absent or scant in that particular specimen. Perhaps the sample was taken at a stage of the disease where the pathogen was rare, where perhaps the viability of the pathogen was lost between the time of collection and the arrival in the lab, or whether the pathogen cannot be detected by this method of testing. So for example, bacteriological cultures will not be able to identify any viruses. So we won't be able to tell you whether this is a viral infection or not. And then you might need to actually order a test in virology for that. Then again, usually physicians don't know that TB cannot be isolated in a routine bacterial culture. So the lab has to be requested specifically for a TB culture if you're suspecting a TB infection. The same goes for fungus. You need to ask the lab to perform a fungal culture, because some tests might not all bacteriological cultures will be able to pick up your bug. So you need to tell us exactly what you're suspecting, and then let us know. And and whenever the bug is isolated, obviously the lab will be able to perform its identification and susceptibility testing where appropriate. I mentioned where appropriate because as part of the routine procedure in the lab, we would report antibiotic susceptibility results on actual pathogens that might be the cause of infection. The lab will not provide susceptibility results for normal flora or for organisms that might be environmental contaminants in that particular sample. The lab will not provide antibiotic results for that. So you need to know, and you might need to discuss with the lab what exactly might be happening here, and where can the lab actually help you get an answer in terms of what the bug might be or why the bug is or isn't growing in a particular sample. Moving on. So important questions before collecting a specimen. Are you suspecting an infection? That's the first question. And if you are suspecting an infection, what is the nature of infection that you're suspecting, whether it's bacterial, viral, fungal, or parasitological? And what tests are your priority? What tests do you want to get results on right now? For example, if you are suspecting, let's suppose, a bacterial culture, do you want to send a fungal culture or a TB culture right there and then? Or perhaps you might want to wait for the bacterial cultures to come back and then send any other culture samples. You need to decide that. When to collect the specimen. If you have any doubt regarding that, of course, the lab can help you. But it is always better to collect the specimen at the start of the infection before any therapy is actually being started. How to collect the sample? Once again, this webinar will give you an idea regarding that, and this is where we'll guide you about how to collect the best specimen in your patient's case. Am I choosing the right container? This is once again a very, very important question. For microbiology, we need sterile containers. We can't take specimen in environmental in non-sterile containers or in containers that are usually used to send histopathological samples. So that's where the problem actually comes. So you have to ensure that you have the right container available in your vicinity when you're collecting a sample for microbiology. Why to send the samples promptly and how to send the samples promptly. So the idea is to make sure that the microbiology sample arrives to the lab as soon as possible. And if for whatever reason, if that is not possible, how do you store the specimen? The lab should be able to provide this information to you, and we'll help you out with that as well. So basic concepts for specimen collection: collect the specimen from the actual site of infection and avoid contamination of adjacent tissues or secretions. So this is once again very important. For example, if you have a patient with let's suppose a prosthetic joint infection, do you want to take a superficial swab in that particular case, or would an actual debridement sample or perhaps tissue or biopsies would be the right sample to set in that scenario? So you need to you have to ensure that the sample is taken from the actual site of infection, and you have to ensure that the site is properly cleaned before samples are taken, because we wouldn't want the sample to get contaminated with any surrounding contaminating or normal flora. So let's imagine if you're taking a throat swab, and I'll be discussing throat swab further. So you have to ensure that that samples are taken from for example, if there's a tonsillar abscess or perhaps there are pockets of pus, the samples are actually taken from that side, and the swab is not touched around in the rest of the oral cavity, because that's where you would pick up the normal oral flora from. So obviously this comes with practice, and one has to be careful when collecting specimens. And when in doubt, always ask for help, and if possible, ask if there's a senior present around you. They should be able to help you out. Collect the sample at the optimal time. So for certain specimens there are specific timing that should be informed to the patient. Is time पे जो है आपने sample देना. For example, if you're suspecting tuberculosis in your patient, it's always better to ask your patient to submit an early morning sputum for TB culture. If your patient is if you're suspecting UTI in your patient, it's always better to ask the patient to submit an early morning specimen. So for certain specimens, there are certain optimal timing that is advised by the lab. And it's always helpful if you could communicate this information to your patient if you need credible results from those samples. Collect a sufficient quantity of specimen and use sterile leak-proof specimen containers. And I cannot emphasize enough on how whenever sending samples to microbiology, you have to ensure that the sample is sterile, and the container is sterile, and the container is leak proof. this needs to be ensured every time you're sending a sample to microbiology, and you have to of course ensure that you have sent a sufficient quantity of material as well. So ऐसा नहीं हो सकता कि 1 cc आपने पास भेजी है, then you expect कि इसमें बैक्टीरियल कल्चर भी हो जाए, फंगल भी हो जाए, TB भी हो जाए. It's a little difficult because for every test we need a certain quantity of specimen, and so if you're unsure कि कितना sample भेजना है, it's always helpful if you could call the lab and just discuss with them that कि कितना sample sufficient रहेगा. Whenever possible, collect specimens prior to administration of antimicrobial agents. Again, very important. Always try to collect specimens before the patient has actually started antibiotics. And for example, अगर आप patient को antibiotic देके घर भेज रहे हैं, it's always helpful to tell the patient to go and submit the sample before he actually starts his antibiotics. So this needs to be ensured as well. Properly label the specimen. Complete the test request form. Very important, because there are many a time where we get pus swabs, or we get tissues, or we get aspirates, and we have no idea where it is from, whether it's a brain abscess, or whether it's a diabetic foot specimen, or whether it's an abdominal abscess. So क्योंकि हर specimen की handling, reporting और management different होती है, so it's always better to please let the lab know where the sample was actually taken from. Always helpful. Minimize transport time. So जैसे ही सैम्पल आप पेशेंट का ड्रॉ करते हैं, पेशेंट को यही एडवाइस करें कि लेबॉरेटरी तक जल्द से जल्द पहुंचा दें, बिकॉज देयर इज़ मैनी अ टाइम एंड वीव एक्चुअली हर्ड इट फॉर पेशेंट्स देमसेल्फ कि वो सैम्पल ड्रॉ करके घर चले जाते हैं, सैम्पल उनके बाद घर पे पड़ा रहता है, एंड दे कम बैक टू द लैब एंड डिपॉजिट द सैम्पल आफ्टर अ कपल ऑफ डेज. सो यू हैव टू एम्फसाइज ऑन द फैक्ट that the patient is informed that the sample should be transported to the lab as soon as possible. And अगर वो sample for example घर लेके जाते भी हैं, उनको इस बारे में भी इन्फॉर्म करना है कि कौन से environment में कितनी temperature पे ये sample रखा जाए और फिर फ़ौरन ही lab पे deliver कर दिया जाए. So this is once again very important, and I'll be talking about what would be the appropriate temperature to hold a sample in my following slides. If appropriate, decontaminate the skin surface before aspirating a sample. For example, अगर कोई patient आपके पास आया, उसको abscess बना हुआ है, and you need to draw the specimen, or perhaps you're planning to do an LP, it's always better to decontaminate the skin surface properly, first with alcohol, and then with either chlorhexidine or bioiodine, and then allow the disinfectant to dry, and then go ahead and draw your sample. So it's very important that the skin is appropriately decontaminated before the sample is actually drawn. And in case, once again, in case if you're going to be ordering more than one test, please ensure that there is proper sufficient amount of sample that is submitted to the lab. So optimal times for specimen collection must be established for the best chance of recovery of the causative microorganism. If in doubt, call the lab. Will help you know what the optimal time is. Apply aseptic procedures, techniques throughout the procedure. Very important. Obviously, we should be washing our hands before and after sample collection, and ensuring that proper PPE are worn by whoever is collecting the specimen. Collect the specimen at the appropriate phase of the disease. Collect and place the specimen aseptically in an appropriate sterile container. Ensure that the outside of the container is clean and uncontaminated. If possible, if your outer container does get contaminated, it's always helpful just to clean it with a disinfectant. Close the container tightly so that its content do not leak during transportation. So this is also very important. We wouldn't want your sample to get contaminated or to be lost in transport. So you have to ensure that whatever sample is being submitted is the container is tightly closed. And of course, clearly indicate the source and the type of culture that is requested. So one thing that we have to absolutely remember, that all specimen and all body fluids are potentially hazardous. So we don't know, you might not actually know what infection the patient might be suffering from at that point in time. So you have to be absolutely sure that these specimens and these body fluids are handled properly with the appropriate PPE, and of course you have to ensure that these samples do not come in direct contact with your skin surface. And in case if that happens, you have to ensure that you have the skin surface is properly washed with soap and water, and of course we have to ensure that we don't get exposed to these specimens and we don't get infected with any of these pathogens that might be causing the disease. So this slide is about microbiology cultures turnaround time. So how long does a culture usually take? So for blood cultures, the lab actually holds the bottles for at least 5 days. So ये सिर्फ वो टाइम है जो मैं आपको बता रही हूँ कि इतना टाइम मैक्सिमम जो है लेबोरेटरी ब्लड कल्चर की बॉटल्स अपने पास होल्ड करती है. For example, if the bottle comes back, turns positive, let's say on day 2 and day 3, we take another 48 to 72 hours to actually identify what the bug is and what antibiotics are working on that bug, and then report release the report thereon. तो ये कहना कि ब्लड कल्चर बहुत देर लगाता है या 8 से 10 दिन लगते हैं इनके अंदर, ये थोड़ा सा एक मिसस्टेटमेंट होगा. Because usually what happens is if the patient is bacteremic and if there are enough bacteria in that patient's sample, the bottle should come back positive on day 1 or day 2. और जैसे ही बॉटल पॉजिटिव आएगी जो है पेशेंट्स या उनके डॉक्टर्स के पास एक कॉल चली जाएगी फ्रॉम द लैब एंड विल गिव यू अ प्रिलिमिनरी रिपोर्ट रिगार्डिंग दैट ब्लड कल्चर की. फॉर एग्जांपल इसमें ग्राम नेगेटिव रॉड आ रहा है या इसमें ग्राम पॉजिटिव कोकाइन क्लस्टर्स आ रहे हैं, एंड विल गिव यू अ प्रिलिमिनरी रिपोर्ट, एंड विदिन 48 hours or 72 hours of that preliminary report, we will start working on that bug. We'll try to identify it, test the antibiotics, and then report the results thereon. Stool cultures are routinely incubated for 48 hours in the lab, and if there is a pathogen that was isolated from that specimen, तो फिर हम उसे वैसे following that time हम उसे report कर देते हैं. And once again, it could take anywhere from 48 to 36 hours to identify and report the antibiotics. Same goes for urine culture. Same goes for pus swabs, tissue and pus aspirates and sterile body fluids. These are incubated for a minimum of 72 hours. 72 लिखना था यहाँ पे. And again उसमें हम anaerobe भी लगाते हैं, anaerobic cultures भी लगाते हैं, and then we for example जब भी bug हमारे पास आएगा we'll start working on it immediately. TB cultures, it's a known fact that TB organisms actually grow very slowly. TB bacteria tend to grow very slowly, and so these cultures might take anywhere between 6 to 8 weeks till they are finally reported. For fungi, so for certain fungi can also take longer to grow, so fungal cultures will also take at least 2 to 3 weeks before it is finally reported out. So I'm going to move on and talk about blood cultures now. Very important specimen that is sent to the lab, and it's only adequate that I spend a couple of slides and next couple of minutes talking specifically about blood cultures. So blood cultures are the gold standard for diagnosing bacteremia. So if you're suspecting sepsis, if you're suspecting endocarditis, blood cultures are your go-to specimen. And detecting the presence of bacteria in the blood is one of the most important functions of the clinical microbiology lab. And ये नीचे जो मैंने आपको पिक्चर दिखाई है ये automated blood culture की bottles हैं, and these are the ones that we have available in our lab. So we actually have the back alert blood culture bottles, and we have the back alert automated system in our lab, and these are the bottles that we use. So it's always helpful to find out कि अगर for example आपका अस्पताल या आपकी लेबोरेटरी में कौन सा blood culture methodology available है, because there are hospitals that are still using manual blood culture bottles, and so manual blood culture bottles are dealt differently and automated blood culture bottles are dealt differently, and it's always better to find out कि bottles कौन सी और system कौन सा है. So we have the back alert system in our lab, and ये जो इनका कलर है ये बताता है कि ये कौन सी वाली blood culture bottle है. So for example, the blue cap bottle, the blue lid bottle is the aerobic blood culture bottle. The purple, the maroon cap bottle is the anaerobic blood culture bottle. The yellow cap bottle is the pediatric blood culture bottle. So जब हम blood culture की बात करते हैं, whenever you send a blood culture, you're supposed to send a set of blood culture. And what do we mean by a set of blood culture? We mean aerobic bottle plus an anaerobic bottle. So one set of blood culture is one aerobic bottle and one anaerobic bottle. अगर आपके पास patients जो आते हैं वो बच्चे हों, pediatric cases हों, so in pediatric cases we choose a single pediatric vial, ठीक है, and उसमें सिर्फ एक single bottle जाती है of in pediatric cases. So when collecting blood culture is very important that you should know the timing of blood culture कि blood culture लेना कब है, skin disinfection कैसे करनी है, blood collect कितना करना है, कब करना है, कितनी bottles में करना है, how long are you going to ask the lab to hold the bottles for incubation, and are there any special pathogens that you are looking for. So just going to discuss that in the next couple of slides. So regarding the timing of blood culture, so the best time to collect blood culture is when the patient is having a febrile episode or just before the onset of shaking chills, and definitely before antimicrobials have started. So this is of utmost importance. एंटीबायोटिक शुरू करने से पहले आपने ब्लड कल्चर लेने, पेशेंट को जब फीवर हो रहा हो या जब आप एंटिसिपेट कर रहे हो कि इसको हैव शेकिंग चिल्स, उससे पहले हमने सैंपल ड्रॉ करना है. यूजुअल रिकमेंडेशन यही है कि एट फर्स्ट एनकाउंटर इफ यू आर गोइंग टू बी सेंडिंग ब्लड कल्चर्स, टेक 2 blood cultures simultaneously. There are no recommendations about the interval between these 2 blood cultures, but ये के recommendations ये हैं that at least 2 blood cultures should be drawn simultaneously at the first encounter, and if you're suspecting sepsis or bacteremia in your patient. Skin antisepsis. Now, skin antisepsis or skin decontamination is an extremely important step when you're collecting samples for blood cultures, because the skin is normally colonized with normal flora और environmental flora. अगर ठीक से skin की decontamination या antisepsis नहीं की जाएगी, we'll end up introducing these environmental bacteria into the blood culture bottle, and then it's going to lead to a false positive with these environmental bacteria. तो होगा ये कि जो actual cause of infection है, we won't be able to identify that, because वो जो normal flora है वो सारा overgrow कर गया होगा blood culture की bottle के अंदर. So you're potentially losing your opportunity to find out कि यहाँ पे cause of infection क्या है. And of course इसमें time भी बहुत ज़ाया होता है, blood culture की cost ज़ाया होती है, patient का अपना time ज़ाया होता है, perhaps patient को गलत antibiotic इसकी वजह से मिल सकती है. So this one single step can actually help us rectify all the further consequences that might arise because of blood culture contamination. So improper contamination of skin can lead to contamination of blood cultures, and it's always better that dedicated staff are nominated who would actually collect these blood samples properly. So this would ensure that contamination is avoided. So as I had previously said, contamination hampers ideal reporting. Contamination agar grow hogi, so we won't be able to tell you what exactly was the cause of infection over here, because we've lost that bug. Time is lost, and of course issues ka kya hoga, wrongful therapy will be instituted, there will be treatment failure, and there will be increased management costs that the patient would have to bear. Moving on. What are the common antiseptic agents that are used for skin disinfection? So the way to go is कि एक दफ़ा आपने site identify कर ली, कहाँ पे आपने जहाँ पे आपने pick करना है, you have to clean that area with alcohol. You have to make sure it's at least 70% alcohol, and हो सकता है कि आपको 2 से 3 दफ़ा उस एरिया को साफ करना पड़े, because the skin is naturally covered with sweat, with dust, with skin oils, so that has to be clean. So with alcohol and considering fashion from inside to outside, हो सकता है कि 2 से 3 दफ़ा आपको ये अमल repeat करना पड़े. Then you let the alcohol dry, and this is followed by disinfection with 2% chlorhexidine or chlorhexidine gluconate, and this is applied on following the alcohol. Once again, inside to outside concentric fashion में आपको जो है साफ करना है, and then you have to ensure that the chlorhexidine actually dries उसके ड्राई होने के बाद ही आपने वहाँ पे प्रिक करना है, उससे पहले आपने प्रिक नहीं करना है, बिकॉज जब तक क्लोरहेक्सिलीन सूखेगी नहीं वो अपना काम नहीं करेगी. सो वी हैव टू इंश्योर that the chlorhexidine actually dries before you're going to do your phlebotomy on this patient. So just repeating my statement from the last slide, after palpation of the area we're going to perform your phlebotomy, clean that area with 70% alcohol for at least 30 seconds, then apply chlorhexidine, and then once again let it dry before you perform your venipuncture. Sample collection कैसे हो सकती है? So you can use either use a needle or a syringe to draw your blood culture samples. You can also use butterflies to draw your blood culture samples. याद रखने वाली बात ये है यहाँ पर that if you're going to use a needle and a syringe to draw blood culture samples for a patient, you would inoculate blood into the anaerobic bottle first, and then you move on to your aerobic bottle. If you're going to be using butterflies to draw patient from your samples, you would inoculate blood first in the aerobic bottle and then in the anaerobic bottle. So you have to remember this. You could also use vacutainers to draw blood culture samples. Now vacutainers actually come in handy अगर आप patient के बहुत सारे blood samples draw करने वाले. So if the patient has UCE or CBC or LFT के भी samples उसके draw करने वाले, that's why vacutainers come in handy. And it's always better कि सबसे पहले आप blood culture का sample draw करें and then you move on to your other samples. Okay. And if for example your patient is admitted in the hospital and he has central lines in place, or perhaps the patient has any PICC lines in place, इसके भी जो है instructions हैं अलग से. Now advice ये है कि routine blood cultures should not be drawn from these catheters or these central lines, because these catheters may be colonized or they may be contaminated, so that will once again lead to false positivity of your blood cultures. So it's always better to avoid drawing your blood cultures from these lines. Only draw cultures from these samples if you are suspecting a catheter related bloodstream infection. And it is extremely important कि अगर आप एक catheter related bloodstream infection suspect कर रहे हैं तो फिर आप simultaneously 2 blood cultures advise करेंगे. One blood culture will be drawn periphery and the second blood culture will be drawn from the central line. If your central line has multiple ports, जैसे कि यहाँ पिक्चर में दिखाया गया multiple ports हो इनके, तो फिर हर पोर्ट से एक separate blood culture draw किया जाएगा. ठीक है? So I hope I've been clear in emphasizing that if you're suspecting a catheter related bloodstream infection, always draw a peripheral culture and a culture from the line. And if your line has multiple ports, then you have to draw cultures from all these ports. And there's another piece of advice that goes along with this. If your patient has a catheter, and once again I re-emphasize the fact कि हम peripheral catheters की बात नहीं, हम cannula की बात नहीं कर रहे जो patients को लगे होते हैं, हम central line और long term catheters की बात कर रहे हैं. Once the catheter is actually detached from its tubing and जो उसका hub होता है, उस hub को आपने alcohol से साफ करना है, and a small amount of blood will actually be discarded. So 3 ml of blood will be discarded in cases of adults. 0.2 ml will be discarded for children, and then उसके बाद का जो blood होगा वो आप draw करेंगे to inoculate into the blood culture bottles. Okay. So just repeating myself over here. अगर आप if you're suspecting catheter-related sepsis, you always have to draw 2 cultures. One set is drawn from the suspected catheters. The second set is drawn from the peripheral site. You have to ensure that both of these blood cultures are drawn at the same time. So it's always better to always mark the time of collection on the blood culture bottle or on the test request form. And differential time to positivity will help you in diagnosing the cause of infection. So the whole idea is if you're suspecting a catheter-related infection, और आपको जो कहा जा रहा है कि एक आपने पेरिफेरल साथ में ड्रॉ करना है और एक लाइन से कल्चर ड्रॉ करना है. जब आप इसको लैब में भेजेंगे, वी विल बी इंक्यूबेटिंग these bottles simultaneously. अब देखना इनमें से ये है कि इसमें से पहले बॉटल कौन सी पॉजिटिव आती है. सो नाउ वी आर अज्यूमिंग दैट जिस बॉटल में ज़्यादा बैक्टीरिया की कॉन्सेंट्रेशन होगी वो वाली बॉटल पहले पॉजिटिव आएगी. Okay, so for example, if your line is colonized with bacteria, then your line should have more number of bacteria the sample drawn from your line will have more bacteria than the sample drawn from your peripheral side. So अगर आपकी peripheral वाली blood culture bottle 2 घंटे पहले positive आती है than your catheter वाली bottle, so it means that your catheter is not the cause of infection. कोई और source है of your infection in this scenario. But if your catheter वाली blood culture bottle comes back positive 2 hours before your peripheral blood culture bottle, that means your catheter was the cause of infection over here. और यहाँ पे फिर अब आपको decide करना पड़ेगा कि catheter निकालना है या replace करना है. And if both of your bottles come back positive at the same time, then obviously it means कि यहाँ पे catheter जो है की वजह से जो है sepsis नहीं हो रहा या infection नहीं हो रहा, यहाँ पे कोई और cause of infection है. The other thing that we would like to mention over here is कि अक्सर हमारे पास catheter की tips भेजी जाती हैं culture के लिए. Now there is no point in sending just the tip for culture. It's always better कि अगर आप एक catheter tip भेज रहे हैं हमें culture के लिए, तो एक साथ में एक peripherally drawn culture भी आप हमें भेजें. सिर्फ catheter की tip को culture के लिए भिजवाने का कोई फ़ायदा नहीं होता. It's always better that a supporting blood culture is also sent along with the catheter tip. Okay, and once again just re-emphasizing the fact that you should not send blood cultures from peripheral vascular lines or cannulas. वहाँ से blood culture please draw मत कीजिएगा. Then in cases of endocarditis, what is the recommendation? So recommendations ये हैं that at least 3 sets of blood cultures should be collected from 3 different sites if you're suspecting endocarditis, and the time difference between these 3 blood cultures should be at least 1 hour. So इसका easy way ये है कि आपने हर आधे घंटे के बाद एक blood culture draw करना है, तो आपका ये criteria पूरा हो जाता है if you're suspecting endocarditis. And it's always helpful to send cultures before your antibiotics are instituted. Number of blood cultures. So obviously यहाँ पे जो बात emphasize करने वाली ये है कि the more number of blood cultures that you send to the lab, the higher are the chances that we are able to pick the causative bug, and the sensitivity of blood culture actually increases with the increasing volume. So if you're going to be sending just 1 blood culture, sensitivity of that blood culture would be 73%, but if you're going to be sending at least 2 to 3 blood cultures, the sensitivity of the test will massively increase to up to 98%. So it's always helpful to send more than 1 blood culture. And for example, now this is just to guide you कि आपको blood culture की फिर से information कैसे obtain करनी है. So for example, if your patient has come to you with his first septic episode and you've drawn 2 to 3 blood cultures and you've sent them off to the lab, and but lab जो है आपको अभी भी कह रही है कि cultures negative आ रहे हैं, but your patient is still septic and you're sure कि ऐसे कोई infection है, so it's always better to repeat that the blood culture, especially if the patient is having a febrile episode. And if following that the blood cultures are still negative, then you need to look at other causes of infection, or you could ask the lab to prolong the incubation of those blood cultures, because हो सकता है कि उसमें कोई slow growing bug हो, or you might actually need to repeat the entire protocol once again. Volume of blood culture. Now ये जो blood culture की bottles आपको यहाँ पे दिखाई जा रही हैं, जो ये black colored की blood culture की bottles है, recommendation ये है कि if you have an adult patient that comes to you, 20 ml of blood would be drawn for these to be inoculated into these bottles. 10 ml into the aerobic bottle and 10 ml into the anaerobic bottle. So it's very important that the adequate volume is drawn and then inoculated into the bottles, क्योंकि अगर कम blood डालेंगे तो chances हैं कि फिर आपका cause of infection यहाँ पे miss हो जाएगा, and we wouldn't be able to help you identify whatever is the culprit in this situation. In children the recommendation is according to their weight. So if it's a child of less than 1 kg, you could drop to 2 ml in this scenario, and then जैसे जैसे उसका weight बढ़ता है आप फिर volume जो है बढ़ाते जाते हैं. Laboratories जो हमारे collection centers है उनके पास जो है ये table already मौजूद है, तो उनके पास ये information होती है कि अगर for example अगर बच्चे आते हैं उनके वजन के हिसाब से फिर उनका blood का volume draw किया जाता है for blood cultures. So this slide is just to re-emphasize the fact how important it is to ensure that the adequate quantity of blood is actually sent to the lab when sending blood cultures. If you're अगर आप कम sample भेजेंगे, so the lab won't be able to help you identify the cause of infection यहाँ पे क्या है. So to ensure that we are able to identify the cause of infection, adequate quantity of sample has to be sent. Duration of incubation. So हमारे पास जो automated blood culture systems हैं, we hold the bottles for 5 days. This is in accordance to international guidelines. Guidelines यही कहती हैं कि at least 5 days तक आपने blood culture की bottles को hold करके रखना है. But there are certain conditions where you can actually request the lab to hold the bottles for longer. So for example, if you're suspecting endocarditis or brucellosis or candidemia, you can call the lab and let them know कि please मैं ये suspect कर रहा हूँ, and could you hold the bottle for longer. So in those cases, we hold the bottles for at least 3 weeks or 21 days. And this is we do that especially for endocarditis, for brucellosis, and for candidemia. So but for example, जो हमने अभी शुरू में आपको बताया था कि ब्लड कल्चर के सैंपल्स को नहायत एहतियात के साथ आपने स्किन को डिकंटामिनेशन करनी है स्किन की और फिर ब्लड कल्चर के सैंपल्स ड्रॉ करने हैं. बट फॉर वट एवर रीजन, इफ देयर इज अ लैप्स in the decontamination procedure, there are chances that your blood culture is going to get contaminated, and one of these organisms would be isolated in your patient's blood culture. Now please note that these organisms are environmental environmental organisms. I wouldn't really call them pathogens. Some of them are part of the skin flora, some are part of the soil. So these organisms are not exactly the cause of infection, and so these shouldn't be treated. हमारे पास जब भी ब्लड कल्चर के अंदर कंटामिनेशन आती है, हम नीचे एक नोट लिख के भेजते हैं. So it's always helpful for the physician to actually read that note, because उसमें हमने instructions दिए हुए होते हैं regarding whether this should be treated as a contaminant or this should be treated as a pathogen. Please read that information. Okay. Moving on, when rare organisms are suspected in such as brucellosis or Campylobacter or Bartonella, please let the lab know, because हो सकता है कि हमें जो है longer incubation देना हो in इस cases में. And you do realize that you might know that Brucella is a very contagious organism, and there are chances that the lab staff might get infected. So we have to ensure that these samples are properly handled. So it's always helpful if we know this beforehand कि ये suspected infection था यहाँ पे, ताकि उस sample की handling और फिर जब cultures positive आएंगे तो उसकी handling वैसे ही हो. If you're suspecting candidemia, इसमें same route यही procedure follow करना है. कोई procedure का फर्क नहीं है, but just let the lab know that you're suspecting candidemia, because in that case we would be holding the bottles for longer. Moving on to CSF cultures. So examination of CSF is an essential step in the diagnosis of any patient with the evidence of meningeal irritation. Lumbar punctures are usually done to collect CSF for examination, and obviously LPs has to be done by someone who's trained in the procedure, and they would need to ensure that all aseptic precautions have been taken before the sample has been drawn. Almost 3 to 10 ml of CSF should be collected, and when CSF is sent off to the lab, part of it is used for biochemical analysis, जिसमें वो glucose protein बताएंगे आपको. Cell counts के लिए sample भेजा जाता है, microscopy के लिए sample भेजा जाता है, and of course if you're suspecting a bacterial or fungal infection, cultures के लिए भी अलग से sample भेजा जाता है. So you have to ensure that adequate amount of sample is sent so that ये सारे tests हम पूरे कर सकें. Important precautions that need to be taken that need to be taken for CSF collection and transportation. You need to ensure that the CSF sample is collected in a screw-capped sterile container. You should not delay the transport and lab investigation. In case where a delay is anticipated, please ensure that the sample is stored at room temperature, not in the refrigerator. CSF samples have to be stored at room temperature. And of course, because it's a very precious sample, it has to be handled properly, क्योंकि दोबारा तो फिर आपके लिए repeat sample निकालना मुश्किल होगा. And of course, lumbar puncture is such an invasive procedure, we wouldn't advise that a repeat procedure be done for the lab. In case of patients with VP shunts, and if you're going to be sending samples for VP shunt, it's always better to let us know कि sample कहाँ से कौन से end से लिया, whether the sample has been taken from the exteriorized ventricular end or from the peritoneal end. It's always better to please let the lab know. And of course, if you're taking samples from the reservoir, once again, please let the lab know कि आपने sample कहाँ से draw किया है. What are the tests that we offer in the lab on CSF? Obviously, we offer microscopy and culture for bacteria, for fungi, for TB. We also offer the gram stain. We also offer the India ink on CSF samples. We also offer cryptococcal antigen testing in CSF samples. And if you're suspecting TB in your patients, it's always better to send an expert MTB ref assay rather than sending the sample for just an AFP. So ये एक जो है mistake हम अक्सर देखते हैं कि physicians करते हैं. If you're sending a pressure sample, if you're sending something like a sterile body fluid or a CSF or a pus sample, please सिर्फ AFP stain मत मांगिए लैब से, क्योंकि stain की sensitivity low होती है. You might actually miss out on your diagnosis over here if you just send the sample for AFP stain. It's always better कि आप है ना TB culture ही भेजिए, and if you have a sterile body fluid, it's always better to send a gene expert assay along as well, क्योंकि ये आपको in short duration आपको बताता है कि इसके अंदर TB है कि नहीं, and of course ये MDR TB है कि नहीं. Sterile body fluids, once again, need to be sent in sterile screw-topped container. And sterile body fluids, kaun se hote hain? These are fluids that are other than blood and CSF. So these might include your peritoneal, pleural, pericardial fluids, and of course we routinely receive these samples in the laboratory. अक्सर हमने देखा है कि जब सिरिंज में हमारे पास सैंपल आते हैं तो जो सेंडर है वो सिरिंज की नीडल को ऐसे बेंड करके उसके ऊपर टेप लगा के भेज देते हैं. सो प्लीज़ डू रियलाइज दैट फैक्ट दैट दिस इज़ एक्सट्रीमली डेंजरस, क्योंकि जो हमारे यहाँ पे लैब में हैंडल कर रहे होते हैं सैंपल, वो टेप उतारते हुए वो अक्सर जो है नीडल उनको ब्रेक हो जाती है. सो इट्स ऑलवेज एडवाइजेबल नॉट टू डू दैट. प्लीज़ डू नॉट बेंड द नीडल्स एंड रैप इट in tape and send the samples. इस तरह के stoppers हर collection center पे available है, so you can ask them for the stopper, and the syringe can be, the needle can be replaced, and then these samples are safer to send to the lab. So it's always helpful to get the stopper from the lab. आपको collection center से ये stopper मिल जाएंगे. Regarding sterile body fluids, if for example आपके पास specimen कम है and you would like to send them for cultures, you could also send them in blood culture bottles. So for that, a minimum of just 1 ml of specimen is required per bottle, and you could inoculate them into your aerobic and anaerobic bottle sets. If you're suspecting TB, or if you're suspecting fungus, or you're suspecting any other special pathogens, then it's always better to send the sample in a sterile container rather than in blood culture bottles, because they will need to be handled differently or separately. Okay. Advantages of adding these samples into the blood culture bottles is that it simplifies the specimen processing, it shortens duration time, of course it enhances recovery of some fastidious pathogens, but disadvantages का सबसे ज़्यादा ये है कि contamination भी हो सकती है अगर बॉटल के अंदर ठीक से सैंपल इनोकुलेट नहीं किया गया या फिर बॉटल कैप को ठीक से क्लीन नहीं किया गया. So contamination can actually be introduced into the bottle. For bone marrow aspirates, can also be sent in blood culture bottles around 0.5 to 2 ml. If you're suspecting TB in someone's bone marrow, then it's always advisable to let the collection center or let the lab know कि आप TB suspect कर रहे हैं किसी के बोन मैरो में. सो उसके लिए आपको एक स्पेशल बॉटल भिजवाई जाएगी, एंड देन यू कैन इंट्रोड्यूस द सैंपल डायरेक्टली इनटू दैट बॉटल. फॉर फंगल कल्चर में भी अगर जो है आप ब्लड कल्चर की बॉटल में बोन मैरो इनोकुलेट करके भिजवा सकते हैं. And of course, it's always better to submit as much as sample as possible, and if you can't inoculate it into a blood culture bottle, you can always send it in a sterile screw cap container. Okay. Moving on to wound infections. So wound swabs, pus aspirates, tissue biopsy, these are what we usually include under wound infections. And ever so often that the most common wound swabs are one of the most common samples that are received in the lab for cultures. Now the problem with swabs is that swabs are poor choice of taking pus samples or taking wound cultures, because these swabs tend to dry easily and they have a limited amount of material that can be picked up by swabs. And the other problem is that the fiber in the swabs can actually trap the bacteria, and these would not be released onto the culture plates. But obviously अगर आपका सिनेरियो ऐसा है जहाँ पे आप फॉर एग्जांपल पस एस्पिरेट नहीं कर सकते या टिश्यू बायोप्सी नहीं ले सकते, so in those scenarios obviously yes, a pus swab would be a wound swab or a pus swab would be the best sample to take. But you have to ensure that the wound was actually properly cleaned with saline and then sent off to the microbiology lab, because फिर skin का सारा flora जो contaminating flora है वो भी वहाँ पे उसमें से grow हो रहा होगा, and then the lab won't be able to decide whether this is the actual cause of infection या ये वहाँ का colonizing normal flora है. Okay, wound swabs are often performed at the same time as wound dressing change, and obviously these should be performed only after the wound has been properly cleaned with normal saline. तो इस तरह के usually जो है swabs जो है लेबोरेटरी एक्सेप्ट करती है. ड्राई स्वॉब्स ना भेजिए, हमारे लैब में जो है ट्रांसपोर्ट मीडिया वाले स्वॉब्स अवेलेबल हैं. यू कैन कलेक्ट दोज एंड फॉर collecting the specimen from your patient. In case you're sending pus aspirates or tissue or punch biopsies or curettage samples or debridement samples, once again ये आपके screw top sterile containers come in very handy. These are very useful, especially अगर theatre में samples आप लोगों ने draw किए, so it's always helpful to send these your samples in these containers. Please do not send your samples in those containers जिसमें histopathology के samples आते हैं, because वो sterile नहीं होते, and then फिर potentially the samples get contaminated and we will lose the cause of infection over here, and we won't be able to report the right bug for your patient. So the ideal sample is pus or exudate, and it should be submitted in a small screw cap bottle that has been tightly closed. Fragments of excised tissue removed at wound toilet or curettings from infected sinuses or other tissues should be sent in sterile container. एक और चीज़ जो यहाँ पे मैं emphasize करना चाह रही हूँ, for example in patients who have sinuses, there's no point in actually sending wound swabs from top of the sinus, because sinus के ऊपर तो सिर्फ आपका colonizing flora आ रहा होगा, वहाँ से culture sample लेके भेजने का कोई फ़ायदा नहीं होता. It's always better if the infected sinus can actually be excised and then sent to micro for culture. That information will be more useful for you, because ऊपर से culture, sinus के ऊपर से culture लेने का technically कोई फ़ायदा नहीं, वो आपको सिर्फ वहाँ का skin का normal colonizing flora ही बता रहा होगा. Obviously, we need to know how the sample was actually collected, because if the sample was collected in the OT or if the sample was actually collected superficially in a clinic, there's a difference on how these samples would be treated. So it's always better to have this information, to let the lab know about this information. And once again, if you're suspecting any unusual bugs like TB or nocardia or actino or fungal infections, do let the lab know, because in organisms के लिए special media की ज़रूरत होती है, and these organisms have to be dealt differently, and these specimens have to be incubated for longer periods of time. Please note that swabs are not optimal samples if you are suspecting TB or you're suspecting fungal infections. It's always better to send tissue or aspirate samples, and swabs should be avoided in these scenarios. Okay, and swabs are also not accepted for TB cultures or perirectal abscesses or oral abscesses, not recommended. And this is just an example of just to show you the difference between between pus that has been aspirated from an infected joint versus a swab that was taken from the top of an infected joint. So you can see the difference कि ये हमें lab में बहुत helpful होता है. So the picture the plate on the left actually shows you the actual cause of infection. उसके ऊपर सिर्फ cause of infection grow कर रहा है, और the plate on the right has 2-3 different type of organisms growing in it. और फिर इस scenario में हमारे लिए मुश्किल हो जाता है to identify what is the cause of infection and what is the contaminating flora. For urine cultures, again, a very important specimen that is received in the lab. So urinary tract infections are some of the most common bacterial infections that are seen by doctors in their clinics and that we see in the hospital. And urine is one of the most common sample that is received in the lab. Under normal circumstances, urine in the bladder is sterile, but obviously once the urine actually comes out through the urethra, it actually gets contaminated by the bacteria that normally colonize the urethra, the genitalia. And do remember that some of these bacteria are even the cause of UTI. But then in the lab we have our own protocols in accordance to international guidelines, and then हम quantify करके बताते हैं कि यहाँ पे infection का cause क्या है. But one has to ensure that the patient has submitted the right sample in this scenario. Now, urine is a good growth medium, and it supports the growth of all type of bacteria. So it is a must that the sample is collected properly and aseptically. So for microbiological cultures, it is recommended that a clean catch midstream urine is submitted to the lab. एंड अक्सर ऐसा होता है कि हमारे डॉक्टर्स जो हैं पेशेंट को पहले से एक्सप्लेन नहीं करते कि क्लीन कैच मिड स्ट्रीम यूरिन क्या होता है, और अक्सर औकात पे जो है कलेक्शन सेंटर पे या लेबॉर्ट्री वाले को भी नहीं पता होता कि ये मेथड क्या है जो है सैम्पल प्रोवाइड करने का. सो टू रेक्टिफाई दैट वी हैव कम अप with a solution, and I'll be showing you the solution in the next slide. One thing that is also recommended is that when you're sending a sample for urine culture, it's always better to send a sample simultaneously for urine analysis as well. So I'll come back to this slide in just a minute. So to help doctors and physicians and to help our collection center staff in providing instructions regarding urine culture samples, ये brochure जो है बनाया गया है, and these are available at all of our collection centers. So अगर for example physicians को नहीं पता कि कैसे explain करना है to the patient कि midstream urine कैसे देते हैं, so this is the steps have been laid out in Urdu and English, so they can easily go to the center and they can ask for this brochure, and जो है हमारे staff जो है ये brochure उनको provide कर देंगे ये brochure जिसपे instructions सारे दिए हुए. So appropriate instructions have to be provided to the patients when you are advising urine cultures. We have to ensure that it's a early morning specimen. Urine UTI के लिए recommended यही है कि सुबह का पहला पेशाब हो. Early morning specimens need to be submitted. It's a clean catch urine, a clean midstream urine. So what do we mean by clean catch urine? So idea ये है कि patient से हम कहेंगे कि patient urine pass करने जाएंगे, वो रुकेंगे नहीं, वो पेशाब करना शुरू करेंगे, बॉटल सामने लाएंगे. हर बॉटल के ऊपर एक निशान दिया होता है जहाँ तक पेशेंट ने सैंपल भरना होता है, वो वहाँ तक सैंपल भरेंगे और फिर बॉटल हटा लेंगे और पेशाब अपना पूरा कर लेंगे. ये याद रखिए कि यूरिन कल्चर के लिए स्पेशल कंटेनर्स हर सेंटर पे हमारे प्रोवाइड किए गए हैं. दीज आर बोरिक एसिड कंटेनर्स. These containers actually have a powder in them. You have to tell the patient that ये पाउडर उसमें से ज़ाया ना करें, पाउडर ही में उन्होंने पाउडर रहने दें, उसी में ही सैंपल इन्होंने डालना है. So boric acid is basically a transport medium जो कि हम लोग यूज़ करते हैं when transporting urine samples from collection centers to the lab. So ये so that overgrowth ना हो जाए उसके अंदर बैक्टीरिया की. So that's why boric acid has been added into these containers. If for example your patient has a suprapubic catheter in place, so उसके लिए भी strict aseptic conditions के अंदर जो है सैंपल सबमिट कराना है. ऑब्वियसली यहाँ पे हम कोई midstream यूरिन वाला कॉन्सेप्ट नहीं होता है. इसमें जो है डायरेक्टली सैंपल्स जो हैं ड्रॉ कर लिए जाते हैं. सो इफ यू यूजिंग अ स्ट्रेट कैथेटर or a suprapubic catheter or suprapubic aspiration, so samples can be drawn directly from these areas. If your patient is catheterized, if your patient has a urine bag and in place और Foley's लगा हुआ है, urine bag in place है, it's very very important that urine bag से sample ना collect किए जाए. So they more than often हमारे पास जो है samples आते हैं, वह samples have been collected from the urine bag. So urine bag से sample लेना बिल्कुल मना है. So the best way to collect samples in these scenarios are either, for example, if we have a picture, if you have a look at the picture on the right, यहाँ पे एक पोर्ट दिया हुआ है, इस पोर्ट से डायरेक्टली सैंपल ड्रॉ किया जा सकता है. सो इन केसेस where such ports are not available, तो फिर आप थोड़ी देर के लिए जो है इसको फॉलीज को क्लैम्प कर दें या ब्लॉक कर दें. ब्लैडर में एक दफ़ा यूरिन जमा हो जाए तो फिर आप कैथेटर को प्रिक करके यहाँ से सैंपल ड्रॉ कर सकते हैं. Okay, so this is how samples can be taken in patients who are catheterized, and bag से sample लेना बिल्कुल मना है. So never ever take a specimen for urine analysis or for urine culture from a urinary catheter bag. In pediatric patients जो हैं, so this perineal bag is these bags are available for children, obviously क्योंकि बच्चों में तो sample लेना मुश्किल होता है. So these bags are available and they are adhered to the urethral area of the child, and the child can pass urine directly into the bag, and then these bags are submitted to the lab for culture. Obviously इसमें भी contamination के chances थोड़े ज़्यादा होते हैं, but this is the best case scenario in these patients. Okay, scenarios where we might actually reject a sample, never. So अगर bed pan से urine collect किया गया या bag से urine collect किया गया है, these samples will be rejected. Frozen samples will be rejected. 24 hours collection जो हो भी वाले samples भी नहीं accept किए जाते for cultures, and Foley catheter tip भी accept नहीं की जाती for cultures. These are also rejected. Stool cultures. So for stool cultures, what are the recommendations? So diarrhea की पहले definition देख लें. So the IDS says that when the patient has more than 1 day of fever, dehydration, systemic illness, and is passing bloody or watery stools, that's where we would label the patient as having diarrhea, and then obviously that's where you would include a bacterial cause of infection in your differential diagnosis. So the organisms that we can identify in the lab are Salmonella, Shigella, Vibrio, and Campylobacter, and the lab can help you in identifying these organisms in stool cultures. ये याद रखें कि इसके अलावा जो है रूटीन में आपको लैब एक रूटीन microbiology lab will not be able to identify any further causes of bacterial diarrhea. Other cause but if you are, for example, suspecting parasitic causes, उसके लिए फिर आपको separately sample for stool analysis भिजवाना पड़ेगा. Okay, so then we will be able to identify, for example, Giardia or Amoeba, and those would be analyzed on stool microscopy. C. diff अगर आप suspect कर रहे हैं अपने patient के अंदर, so it's always best C. diff as in Clostridium difficile. So it's always best to send the sample for a gene expert C. difficile assay, and the lab will be able to rule in or rule out a Clostridium difficile infection in this scenario. Moving on, parasitic infections अगर आप suspect कर रहे हैं, it's always better to send the lab a fresh stool specimen, and once again the sample should reach the lab as soon as possible, and the same goes for bacterial cultures. And how the samples are collected: the sample can be collected for stool culture. Sample could be collected in a clean bedpan, or perhaps a plastic wrap could be placed on the toilet seat. Stool samples contaminated with urine or toilet water should not be submitted to the lab. Samples should be submitted in a clean, dry container, and they should be transported at room temperature within 2 hours of collection. Okay, and if your patient had, for example, is admitted in the hospital for longer than 3 days and he has developed diarrhea, chances are कि यहाँ पे C. diff होगा. फिर यहाँ पे आप रूटीन बैक्टीरियल कल्चर के लिए सैंपल्स ना भेजें. Only loose and diarrheal stools are recommended for routine bacterial cultures and C. diff testing. So पूछ लीजिए पेशेंट से कि पेशेंट को कि स्टूल की कंसिस्टेंसी क्या है, और उसमें जो है ये वाला चार्ट हैंडी आता है. So this is a Bristol stool chart. इसमें अगर टाइप 6 और टाइप 7 का स्टूल अगर पेशेंट्स पास कर रहे हैं तो दैट्स वेयर जो है आप कल्चर्स के लिए भिजवाएं सैम्पल, वरना टाइप 5 एंड अपवर्ड्स जो है फ़ायदा नहीं है उनका कल्चर्स में भिजवाने के लिए. सो टाइप 6 एंड टाइप 7 हो तो आप बैक्टीरियल कल्चर के लिए भिजवाएं एंड फॉर सी डिफ. ओके. Sputum cultures, so sputum culture के लिए भी there are certain recommendations. It's always better to advise the patient to rinse his mouth before he's submitting the sample. It's always better to advise the patient that he needs to submit sputum or phlegm. For cultures we don't need saliva. तो अक्सर ऐसा होता है कि sputum के cultures में जो है पेशेंट हमें सिर्फ saliva अपना देते हैं, बलगम नहीं आता, तो पेशेंट को प्लीज़ एडवाइस ज़रूर कीजिएगा कि बलगम के सैंपल हमें प्रोवाइड करें. एंड इट हैज़ टू बी a deeply expectorated sample, and of course it needs to be submitted in a dry, sterile, wide mouth container. If you're suspecting tuberculosis in your patient, then it's always better to send an early morning sample. Okay, of course it should be transported to the lab ASAP. If you are anticipating any delay, then these samples can be refrigerated. And you need to tell the lab specifically what is your what is your suspicion over here, and what are you suspecting. Either are you suspecting a bacterial or a fungal or a TB, a TB infection, or in this scenario it's always better to let the lab know, क्योंकि इसका हर एक का sample handling and sample processing जो है different होती है. And we have provided our centers with these brochures so that for example जिन patients को नहीं पता कि sample कैसे देना है, ये brochure जो है assist कर सकता है in explaining to them how these samples need to be submitted. And of course the other samples, respiratory samples that we receive in the lab are tracheal aspirates, bronchial lavages and sinus lavages. Once again, let the lab know कि ये sample exactly क्या है, and then what exactly are you suspecting. In cases of throat swabs, cotton or calcium alginate swabs can be used, and we have to ensure कि बाकी oral cavity में ये swab touch ना करे, and the swab actually touches the areas where there is inflammation or there is pus collection. So this could be the tonsillar fosses, the posterior pharynx, or any ulcerative area. Okay, and then the swab can be placed in the appropriate transfer medium and then transported to the lab. In cases of ear swabs, ये याद रखें कि अगर एक्सटर्नल ईयर स्वॉब आप भेजते हैं तो फिर वो ईयर कनाल में जो भी ऑर्गेनिजम्स होंगे वो उसको ही पिक करेगा. सो these external ear swabs will be processed as superficial swabs. If you are suspecting a middle ear infection, it's always better to send middle ear fluid, and then it will be handled as a sterile body fluid in that scenario. And please, obviously, it's better to always mention के sample कहाँ से लिया है. If you're suspecting STDs in your patient, urethral swabs and higher vaginal swabs can also be sent to the lab. In cases of suspected gonococcal infections, please do let the lab know. If you're suspecting an STD, ये याद रखिए कि urine cultures में से STD के हम organisms आपको identify करके नहीं दे सकते. You need to be sending those samples separately. But if you're sending a gene expert sample for chlamydia, trachomatis and Neisseria gonorrhoeae assay, so for that you can submit urine samples. But for urine जो routine urine culture होता है उसमें हम आपको STD के bugs identify करके नहीं दे सकते, right? And if you're suspecting any fungal infections, for example, किसी के you're suspecting fungal infection in someone's hair, in those cases you can actually send us plucked hair, you can send us hair stubs, you can send us skin scales, and these needs to be sent in a sterile container, a dry sterile container. कोई इसमें saline वगैरह आप नहीं डालेंगे. But cut hair is not an acceptable sample, so please avoid sending that. For nails, it's ideal to clean the nail with 70 or 95% alcohol. You should have to remove the outermost layer by scraping with a scalpel, and then you can send the clippings or the discolored or the brittle part of the nail, or scrapings or the deeper debris in sterile container, and we would be able to perform fungal cultures on those specimens. If you're suspecting any skin fungal infections, once again we are looking for skin scrapings, and these should also be sent to us in sterile containers. So I think with this I have come to the end of my presentation. I know this has been quite a lot of information to take in, but I hope this has been helpful. I can now have a look at the questions that have been submitted in the chat box, and perhaps I could take those questions one by one. Naveed Saab, can you share the link for the CME feedback
Yes, I will
in the
share
chat
it now.
box?
Yes, I will share it now. Just
लोग लिंक मांग रहे हैं.
जी, मैं अभी शेयर कर रहा हूँ. Just in 1 minute, inshallah.
Thank you very much. So if you have any questions, I'd be happy to take them. You could put the questions in your chat box, and I can perhaps take them one by one. So clean catch urine, yes. So clean catch urine is just another word for midstream urine. Okay. So idea यही होता है कि पेशेंट जो है यूरिन करना शुरू करेगा, उसने रुकना नहीं है, वो बॉटल सामने लाएगा, बॉटल के ऊपर निशान है, निशान तक वो यूरिन भरेगा बॉटल के अंदर और फिर वो हटा लेगा वो बॉटल. ये आपका मिडस्ट्रीम यूरिन का प्रोसीजर होता है और इसी को क्लीन कैच कहते हैं. पोस्टर्स जो है हमारे कलेक्शन सेंटर्स पे भी मौजूद हैं, एंड if there's a recorded version of this CME that goes online, you could get the posters from there as well. But otherwise हमारे सारे collection centers के ऊपर ये जो है मौजूद हैं. Someone has asked how to take samples for cytology, what is normally recommended. So it's the same procedure. So if you are for example इन्होंने pleural fluid का पूछा है. So for example if you are going to be tapping pleural fluid, जो स्किन का सरफेस है वो अच्छी तरह आपने डीकंटामिनेट करके और एसेप्टिकली आपने सैंपल पर एस्पिरेट करके लेबोरेटरी भिजवा देना है. इट्स द सेम प्रोसीजर फॉर साइटोलॉजी, इट्स द सेम प्रोसीजर फॉर माइक्रोबायोलॉजी, इट्स सेम प्रोसीजर फॉर सेल काउंट. Emphasis is on aseptically collecting the sample and then sending the sample in a sterile container. These are the two things that you need to ensure when sending sterile body fluids to microbiology. Someone's asked me about bone marrow aspirate. So bone marrow aspirates के लिए ये है कि you can either send the bone marrow aspirate in a blood culture bottle. If you're suspecting TB के लिए एक separate bottle होती है, so you have to let the laboratory know that you're suspecting TB in this particular scenario. तो आपको TB के bottle अलग से दे देंगे. और अगर for example ये दोनों available नहीं है, तो you can easily send bone marrow in a sterile container. For endocarditis के लिए recommendation ये है कि आपने 3 सैंपल लेने हैं और आपके पहले सैंपल और आपके आखिरी सैंपल के बीच में 1 घंटे से ज़्यादा का टाइम नहीं होना चाहिए. सो इसका आसान तरीका ये है कि हर आधे घंटे के बाद सैंपल ले लें. एक सैंपल आपने अभी लिया, फर्स्ट सैंपल हो गया. एक सैंपल आपने आधे घंटे के बाद लिया, सेकंड सैंपल हो गया. एक सैंपल आपने उसके आधे घंटे के बाद लिया, तो वो थर्ड सैंपल हो गया. तो 3 सैंपल आपके इसके इस तरह पूरे हो जाते हैं. If the patient is already on antibiotics, then how to collect? अच्छा, इसके लिए ये है कि देखें इसमें 2-3 सिनेरियोज आते हैं. नंबर 1 ऑब्वियसली यही बेस्ट होगा कि आपने पेशेंट को बोला हो कि प्लीज़ जब तक आपके टेस्ट ना हो जाए आप एंटीबायोटिक स्टार्ट ना करें. नंबर 2, फॉर एग्जाम्पल आपके पेशेंट के एंटीबायोटिक स्टार्ट हो गई हैं, बट ही इज़ नॉट इम्प्रूविंग ऑन दोज एंटीबायोटिक्स. सो यू थिंक दैट this is not the right antibiotic for this infection and you would like the patient to go ahead and have this cultures done. ठीक है, फिर उस सिनेरियो में हम सैंपल ले लेंगे. I can tell you that कि हमारी जो नई वाली ब्लड कल्चर की बॉटल्स इस वक्त हमारे पास अवेलेबल हैं, दे हैव एंटीबायोटिक इनएक्टिवेटिंग एजेंट्स. सो वो आपके अगर पेशेंट के सैंपल में एंटीबायोटिक होगी तो उसको इनएक्टिवेट कर देगा. But if your patient is already on antibiotic and he's improving, then I would suggest कि उस सूरत में जो है मत उसके कल्चर्स करवाएं. And there are certain scenarios जहाँ पे हम पेशेंट्स को completely off antibiotics कर देते हैं सैंपल लेने से पहले. That is especially true for orthopedic cases. वहाँ पे एंटीबायोटिक्स बिल्कुल ही बंद कर दी जाती हैं और फिर एंटीबायोटिक्स फिर सैंपल्स लिए जाते हैं. For other scenarios, there's no harm in discussing it with the lab. Perhaps he could guide you. Perhaps we could come up with a solution. CSF सैंपल के लिए recommended यही है कि उनका CSF ट्यूब कौन सी एक्सेप्टेबल है फॉर कल्चर। ट्यूब्स में देखें, कोशिश करें कि सैंपल ना भेजें। जो ट्यूब्स होती हैं, सम ऑफ दीज ट्यूब्स आर नॉट स्टेराइल बिकॉज उनकी प्री रिक्विजिट नहीं होती स्टेराइल होने की ना। प्लस सम ऑफ दीज ट्यूब्स ऑल्सो हैव some sort of preservative as well। जैसे आपकी जैसे EDT ट्यूब्स होती हैं, हेपरिन ट्यूब होती हैं, ये इन ट्यूब में कुछ ना कुछ डला हुआ होता है, so that could hinder hinder the isolation of the bacteria that we are suspecting। So it's always better to send it in a completely sterile या तो कंटेनर हो या अगर sterile syringe में अगर आप भेज सकें तो it's always better to send your sample in that। How much time can throat swabs be transferred to the lab? Ideally हर सैंपल को लेबोरेटरी जल्द अज जल्द पहुंच जाना चाहिए, जल्द अज जल्द। अगर जल्द अज जल्द नहीं होता तो फिर हम 2-3 घंटे दे सकते हैं कि इन 2-3 घंटों के अंदर अंदर सैंपल लेबोरेटरी पहुंच जाए, क्योंकि इतना टाइम तो ऑब्वियसली लग ही जाता है। सो विदिन 2 to 3 आवर्स सैंपल पहुंच जाए। ब्लड कल्चर नंबर फॉर ये पायरेक्सिया ऑफ अननोन ओरिजिन। पायरेक्सिया में भी आप कम से कम 2 सेट भेजेंगे ब्लड कल्चर्स के, तो वो 4 बॉटल्स हो जाती हैं, 2 एरोबिक 2 एनारोबिक। Why urine sample is not collected from urine bag? अच्छा, इसका एक सिंपल सा आंसर ये है कि देखिए यूरिन बैग जो होता है उसमें यूरिन जमा होता रहता है, ठीक है। वो कितने दिन तक लगा होता है, पेशेंट को कहीं कभी कभी 15-15, 20-20 दिन तक वो बैग लगा हुआ होता है। दूसरा, वो जब बैग का नोजल आप खोल के उसको उसमें से यूरिन निकालते हैं, उस नोजल से पोटेंशियली एनवायरमेंटल जरासीम वापस बैग के अंदर चले जाएंगे, ठीक है। फिर ये कि उसके अंदर क्योंकि यूरिन मुस्तकिल जमा होता रहता है, सारे एनवायरमेंटल बैक्टीरिया उसके अंदर जो है मुस्तकिल ग्रो होते रहते हैं। तो ये सैंपल भिजवाना नुकसानदेह होगा मरीज के लिए, क्योंकि फिर हम उसमें से गलत बैक्टीरिया देखेंगे और फिर गलत बैक्टीरिया के ऊपर काम होगा, गलत बैक्टीरिया की रिपोर्ट निकलेगी, तो उसका कोई फ़ायदा नहीं है मरीज को। एट दी एंड ऑफ द डे हमने यही देखना है ना कि मरीज का सबसे ज़्यादा फ़ायदा क्या हो, कहाँ से हो रहा है। मरीज का फ़ायदा हो रहा है, मरीज को सही जरासीम हम बताएं, मरीज के ऊपर सही एंटीबायोटिक इस्तेमाल की जाए। हम नहीं चाहेंगे कि मरीज का नुकसान हो यहाँ पे। ख़ास तौर पे अगर लेट्स इमेजिन ये कर ले कि मरीज आपका कोई अपना हो, यू वुडंट वांट अ रॉन्ग रिपोर्ट टू बी रिलीज्ड ऑन दिस पेशेंट एंड रॉन्ग ट्रीटमेंट टू बी गिवन आउट। ट्रांसपोर्ट टेम्परेचर, देखें आप अगर आप फिजिशियन हैं और आप अगर खुद जो है मरीज को सैंपल हैंड ओवर कर रहे हैं और उनसे कह रहे हैं कि जल्द अज जल्द लेबोरेटरी भिजवा दें, तो रूम टेम्परेचर के ऊपर ये जो है ये सैंपल्स ट्रांसपोर्ट हो सकते हैं। जब सैंपल्स एक दफ़ा हमारे कलेक्शन सेंटर्स पे पहुंच जाते हैं, फिर हमारे अपने वहाँ पे मैकेनिज्म्स है टेम्परेचर को इंश्योर करने के लिए। तो इंश्योर बस इतना करेंगे कि आप रूम टेम्परेचर के ऊपर सैंपल भिजवा दें। फिर यूरेथ्रल स्वैब कैसे लेते हैं? यूरेथ्रल स्वैब के लिए फिर आपको जो है जाहिर सी बात है यूरेथ्रल स्वैब चाहिए होगा। यूरेथ्रल स्वैब आपके रेगुलर स्वैब से थोड़े पतले होते हैं। इसका तरीका ये है कि इसको बस यूरेथ्रा में इंसर्ट करना है, इसको 5 से 10 सेकंड तक अंदर रोटेट करना है और बस फिर उसको आपने फिर रेलेवेंट ट्रांसपोर्ट मीडियम में डालकर सैंपल भिजवा देना है। How much sample is needed for cytology? Well, cytology is not performed in my lab, but at least आपको 15 ml तो चाहिए ही होता है for cytology. Okay, I think PO का तो मैंने mention कर दिया था। अच्छा, बोरिक एसिड का किसी ने कहा है। अच्छा देखें, बोरिक एसिड अच्छा, सो बोरिक एसिड एग्जैक्टली करता क्या है? बोरिक एसिड बैक्टीरिया को मारता नहीं है। लेट मी बी क्लियर अबाउट दैट। इट डजंट किल द बैक्टीरिया, इट विल कंट्रोल द ओवर ग्रोथ ऑफ बैक्टीरिया। सो आई कैन अश्योर यू कि वो बैक्टीरिया मर नहीं रहे, और ये कि इसके ऊपर पहले ही बहुत ज़्यादा काम हो चुका है। इट्स अ नोन फैक्ट। बोरिक एसिड इज यूनिवर्सली यूज्ड अक्रॉस द वर्ल्ड एज अ प्रेजर्वेटिव इन ट्रांसपोर्टिंग यूरिन के सैंपल। सो यू डोंट हैव टू वरी। मेरे पास इस वक्त पूरे पाकिस्तान से मेरी लेबॉर्ट्री में सैंपल आते हैं, सारे बोरिक एसिड में आते हैं। मेरे जरासीम रस्ते में नहीं मरते, दे आर जस्ट ओवर ग्रोथ उनकी कंट्रोल की जाती है। सो यू कैन बी अश्योर्ड दैट योर बैक्टीरिया विल नॉट डाई इन ट्रांसपोर्ट बिकॉज ऑफ बोरिक एसिड। अच्छा, एनारोब के लिए क्या रिकमेंडेशन है? एनारोब के लिए भी रिकमेंडेशन यही है कि उसको जल्द अज जल्द एक दफ़ा आपने सैंपल निकाल लिया पेशेंट से बाहर, उसको आपने अपने स्टेराइल कंटेनर में डाला और फिर फटाफट उसका ढक्कन लगा दिया। उसको ज़्यादातर एयर से एक्सपोज नहीं करना है और आपने फिर उसको लेबॉरेटरी पे फ़ौरन भिजवा देना है। इट्स एज सिंपल एज दैट। जस्ट मेक श्योर दैट इट इज़ नॉट एक्सपोज टू द एनवायरनमेंट एयर फॉर टू लॉन्ग। फिर बोरिक एसिड का सवाल आ रहा है। आई एम नॉट श्योर कि लोगों को बोरिक एसिड पे इतना शक क्यों हो रहा है। बोरिक एसिड एक बहुत अच्छा प्रेजर्वेटिव है, सो यू डोंट हैव टू वरी अबाउट दैट। ओके, हाउ मेनी सैंपल शुड बी टेकन फॉर स्प्यूटम कल्चर? तो रूटीन अगर स्प्यूटम कल्चर करवा रहे हैं आप तो एक सैंपल काफ़ी है। टीबी के लिए रिकमेंडेशन 3 सैंपल्स की आती है। Now that depends on your physician or yourself, but otherwise routine bacteriological culture के लिए एक सैंपल काफ़ी होता है। कोविड के लिए वंस अगेन, कोविड मेरी लैब में नहीं होता, बट कोविड के लिए जो है नेजोफेरेंजियल स्वॉब्स लिए जाते हैं। थ्रोट स्वॉब नहीं लिए जाते, नेजल स्वॉब्स नहीं लिए जाते, नेजोफेरेंजियल स्वॉब्स लिए जाते हैं। प्लीज़ टू रिमेंबर दैट। बोन मैरो का सवाल फिर से आया कि इफ़ यू डोंट हैव योर ब्लड कल्चर बॉटल तो क्या करें? अगर ब्लड कल्चर बॉटल नहीं है तो आप स्टेराइल स्क्रू टॉप कंटेनर में भेज सकते हैं सैंपल्स। ओके, नो वी डोंट हैव अ स्पेशल ट्रांसपोर्ट मीडियम फॉर एनारोब्स, सो वो हमारे पास नहीं है। फंगल के लिए भी आपको कोई ट्रांसपोर्ट मीडिया की ज़रूरत नहीं है। आप जो भी भिजवाना चाह रहे हैं कल्चर, आप उसको एक स्टेराइल जो है स्क्रू टॉप में भेज दें, दैट्स मोर देन इनफ। ठीक है, इसके लिए कोई फंगस के लिए कोई ट्रांसपोर्ट मीडियम अवेलेबल नहीं है। मैं जो हूँ यहाँ पे अपनी लैब के जो है एक्सटेंशन नंबर्स चैट बॉक्स में डाल रही हूँ। ठीक है, फॉर एग्जाम्पल इफ़ एनी वन एवर हैज़ एनी डाउट रिगार्डिंग हाउ अ सैम्पल नीड्स टू बी सेंट and if you're not sure कि कौन सा सैम्पल कितना भेजना है, you can always call the microbiology section and my staff will be more than happy to help you. Our lab works 24 hours a day, 7 days a week और मेरे पास मुस्तकिल स्टाफ मौजूद होता है and my staff would be more than happy to help you out if you have any confusion regarding कौन सा सैम्पल कैसे भेजना है। And अगर ज़रूरत हुई तो आई कैन इवन ऐड एन ईमेल एड्रेस। मैं एक ईमेल एड्रेस भी यहाँ पे लिख देती हूँ, सो यू कैन इवन ईमेल योर क्वेरीज टू अस। वी वुड बी मोर देन हैप्पी टू टेक देम, एंड इफ देयर आर नो फर्दर क्वेश्चंस देन आई थिंक वी कैन रैप दिस अप। Rita?
Yeah, thank you very much, Dr. Sumaya. It was a wonderful session. And for all the participants, please give your feedback and we will ensure to give you the CME certificates. Thank you very much, Dr. Sumaya. Now we are closing the session.
Thank you very much. Thank you everybody for attending the lecture. Thank you.